I used to think some meds were basically safe. But then the data caught up. So today, I'm busting a few myths with what large studies and regulators have actually found from 2018 to 2024. Quick, clear, and referenced. First, Montelukast, brand name Singulair. It was marketed as a mild, long-term allergy and asthma helper for adults and kids. But newer evidence showed a darker signal increased neuropsychiatric effects, anxiety, depression, sleep disturbance, nightmares, suicidal ideation, especially in children. In 2020, the FDA added a boxed warning, and in 2022, Schumacher and colleagues in JAMA Network Open found higher odds of anxiety, depression, and self-harm compared with inhaled corticosteroids. That doesn't mean it's never appropriate. It means the benefit has to clearly outweigh the risk, and families should be counseled about mood and sleep changes. Second, fluoroquinolone antibiotics, Cipro, Levaquin, Avalox. These were the easy-button antibiotics for years, but multiple studies linked them to rare, serious, sometimes permanent complications, aortic aneurysm and dissection, tendon rupture, peripheral neuropathy, agitation, hallucinations. Pasternak et al. BMJ 2018 tied them to aneurysm and dissection. Daneman et al. JAMA. Surgery 2019 flagged tendon and neurologic harms. The FDA reinforced major safety warnings in 2022. Translation: they can still be life-saving, but they're not first choice for routine infections anymore. Third, GLP-1 agonists like Semaglutide, Ozempic, and Wegovy. Incredible for glucose and weight, yes. Originally thought to be very safe beyond nausea, but newer data highlight important risks: gallbladder disease, pancreatitis, intestinal obstruction, or ileus, possible aspiration risk during anesthesia due to delayed gastric emptying, and muscle mass loss, sarcopenia, especially at higher doses in older adults. There are also ongoing EMA, FDA reviews about possible increased suicidal ideation. The big picture: effective tools, used thoughtfully, monitored closely. Bonus lightning round, recent examples worth knowing: methotrexate at low doses for rheumatoid arthritis. Higher than expected interstitial lung disease risk reported in newer observational studies and registries. Gabapentin, respiratory depression in older adults and when combined with other sedatives. Gabapentin, rising misuse potential, FDA, and cohort data. SSRIs in youth, meta-analyses confirm increased suicidality signals and concerns about reduced bone mineral density with chronic use. Benefits can still outweigh risks, but monitoring matters.